High cholesterol rarely presents with visible signs and symptoms. There are rare cases in which there may be physical signs, such as around the eyes and/or over the tendons, but this occurs for the minority of people. Normally, high cholesterol must be screened for and detected via a blood test. If you do in fact get diagnosed with high cholesterol, your doctor can advise you as to an appropriate treatment plan. Recognizing signs and symptoms: look out for yellow patches around the skin of your eyelids. These are called xanthelasma palpebrarum. They may be associated with a certain type of high cholesterol called familial hypercholesterolemia. These yellow patches, which may or may not be raised off the skin. They tend to be located above or below the eye, and often in both locations. They are a sign of cholesterol deposition under the skin. Note, however, that this only occurs in certain high cholesterol syndromes, and that the majority of cases of high cholesterol present with no signs or symptoms at all. Look for yellowish deposits, lumps, in your tendons. These are called xanthomata, and they occur particularly in the tendons of the fingers. If they occur in the palm, knees, and/or elbows, they may be associated with type 3 hyperlipidemia. These often appear as bumps over the knuckles in your hands. There are often many of them present, and in more than one area at once. Again, this only occurs in certain high cholesterol syndromes, and the majority of cases of high cholesterol present with no signs or symptoms. Watch for a white or gray discolored arc in your eye. If you have this, it is called circumferential arcus. The part of the eye that is affected is the cornea, which is the transparent outer covering of the eye. It is easiest to see these lesions over the white area of the eye, as the discoloration tends to be most apparent there. Be aware that elevated cholesterol usually presents with no signs or symptoms. The challenging thing when it comes to detecting elevated cholesterol levels is that almost everyone presents with no visible signs or symptoms. Therefore, doctors rely on screening blood tests to pick up high cholesterol, and to prescribe appropriate treatment as needed. Therefore, even if you have no signs or symptoms, it is advisable to ask your doctor to screen your cholesterol levels at least every 5 years with a simple blood test. Know the risk factors for high cholesterol. Your chance of developing high cholesterol at some point in your life is higher in proportion to your risk factors. The more risk factors you have, the more frequently you should receive screening blood tests from your doctor. Risk factors to be aware of include: eating an unhealthy diet high in fat and sugar, having a large waist circumference, being overweight or obese, living a sedentary life, smoking, and being diagnosed with diabetes or cardiovascular disease. Depending upon how high your cholesterol levels are, your doctor will suggest lifestyle changes with or without medications to help lower your levels. If your cholesterol levels are only borderline high, lifestyle changes alone may be enough to get you back in the normal range. Positive lifestyle changes you can make include: incorporating more aerobic exercise, 3 to 5 sessions of 30 minutes or more each week is recommended. Aerobic exercise includes things like swimming, biking, jogging, or brisk walking, anything that elevates your heart rate continuously for 30 minutes or more. Exercise specifically raises your HDL levels, good cholesterol, which helps to improve your overall cholesterol profile. Eating a healthier diet. Specifically, consuming more fruits and vegetables and reducing fat consumption can help to lower your cholesterol levels. Fiber in particular is one of the mainstay dietary changes to lower cholesterol, so try increasing sources of soluble fiber, such as oatmeal, beans, peas, rice bran, barley, citrus fruits, and strawberries. For more details, please visit our website and link in the description. Thanks for watching this video.